Hi, I'm Joe Graydon.
I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy, where we bring you the stories behind the health headlines.
This podcast is brought to you by Redix Industries, makers of Utterly Smooth Body Cream. 800-345-7339, on the web at uttercream.com. Every day, tens of millions of Americans swallow a pain reliever. Drugs like Advil and Aleve are really popular. How safe are such NSAIDs? This is the People's Pharmacy with Terry and Joe Graydon.
The FDA recently strengthened its warning on nonsteroidal anti-inflammatory drugs such as diclofenac, ibuprofen, meloxicam, and naproxen. The cardiovascular complications of NSAIDs are more serious than most people realize. Do you need to be concerned?
Those with arthritis or other types of chronic pain face a difficult dilemma. Without pain relief, they often have a hard time functioning. What else can they do besides taking NSAIDs?
Coming up on the People's Pharmacy, pain reliever pros and cons and non-drug approaches.
First, this news.
In the People's Pharmacy health headlines, a new analysis of blood sugar shows that diabetes is becoming more common among Americans. The study, published in JAMA this week, reveals that as many as 14% of adults have diabetes. The criteria are a fasting blood sugar of 126 or higher, or a hemoglobin A1C of 6.5% or greater. The HbA1c test is a way of measuring average blood sugar over about 3 months. More than a third of the people with diabetes had gone undiagnosed. Perhaps even more alarming is the number of people poised to develop this serious metabolic condition. This National Health and Nutrition Examination Survey discovered that up to 38% of adults met the criteria for prediabetes. That means their HbA1c was between 5.7 and 6.4%, or their fasting blood sugar was between 100 and 125. The proportion of people with diabetes increased between 1988 and 2011, putting many more people at risk for serious complications such as heart attacks, strokes, amputations, nerve damage, or blindness.
A small study in England shows that people with diabetes can reverse some of the heart complications of the disease with exercise. The study randomly assigned middle-aged men with type 2 diabetes to usual care or to a 3-month program of intermittent, high-intensity exercise. In this case, repeated 90-second bursts of cycling as fast as possible. Those who had participated in the high-intensity training had healthier hearts at the end of the study, with better function of the left ventricle. In addition, the exercisers had less fat in their liver and around their internal organs. The investigators conclude that this form of exercise is a potential therapy to moderate cardiac risk and reduce liver fat in type 2 diabetes.
The hot new approach in cancer treatment is immunotherapy. In this approach, pricey new medications enhance the body's own immune defenses to fight cancer cells better. A surprising study in mice has revealed that giving aspirin, along with some of the new high-tech treatments, can turbocharge their immune-boosting potential. Aspirin seems to be especially helpful for enhancing the effectiveness of an exciting class of drugs that inhibit a compound called PD-1, or programmed cell death protein 1. Aspirin appears to work by blocking prostaglandin E2. Cancer cells make large amounts of this compound to dampen immune system activity. Clinical trials will be needed to see if this preliminary research holds up in humans, but epidemiological research suggests that aspirin itself has anti-cancer action.
Women who have been treated for breast cancer are frequently plagued with terrible hot flashes. The hormone treatment often used for relief from this symptom during menopause is not appropriate for women with breast cancer. Estrogen could spur the growth of breast tumors and must be avoided. A new study offers hope for women in this predicament. Scientists recruited 120 breast cancer patients suffering from many hot flashes every day. They were randomized to receive the medication gabapentin or a placebo, electroacupuncture, or placebo electroacupuncture for 8 weeks. At the end of the trial, women who had received electroacupuncture, acupuncture in which the needles carry a weak electrical current, had the greatest reduction of hot flashes. After 16 weeks, those who had received electroacupuncture were still experiencing the benefits of the intervention. Those who had gotten medication were slightly worse. Although the research should be reproduced, these are exciting results for women suffering the after effects of breast cancer treatment.
Secondhand smoke is deadly, but new research suggests that working long hours under stressful conditions is nearly as bad for health. An analysis of 228 studies assessed the effects of workplace stressors. The investigators found that people who feared they might soon lose their jobs were 50% more likely to become ill than those who felt more secure in their employment. Highly demanding jobs also increase a person's likelihood of a disease diagnosis by about 35%. The researchers suggest that companies might reduce the cost of employee health care by paying more attention to reducing workplace stress. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon. I'm a medical anthropologist.
And I'm Joe Graydon. I'm a pharmacologist. The FDA recently strengthened its warning on the possible cardiovascular side effects of NSAIDs, non-aspirin pain relievers like Celebrex, diclofenac, ibuprofen, meloxicam, and naproxen. How serious is the new warning?
Later in the hour, we'll discuss the new blood pressure study and find out why it was stopped early. How low should you try to get your blood pressure?
We'll also consider the high cost of prescription drugs. According to Dr. Zeke Emanuel, an oncologist and a vice provost and professor at the University of Pennsylvania, we're paying too much for prescription drugs. Cancer drugs like Keytruda, Opdivo, and Yervoy cost over $120,000 a year. Are such prices sustainable?
To discuss these topics and help us answer your questions, we are pleased to welcome Dr. David Kroll to the studio today. He's a pharmacologist and health journalist. His research focused on the discovery of anti-cancer compounds from natural sources, and he's an expert on botanical medicines. Welcome to the People's Pharmacy.
Delighted to be here. Thanks, Terry.
Nice to have you with us, David. You also write for Forbes.com on health issues. But before we go any further, perhaps you can tell our listeners, what is a pharmacologist?
Yeah, Joe, pharmacologists oftentimes get confused with pharmacists. A pharmacologist is generally a laboratory scientist that studies the science of how drugs work. They combine the biology and the chemistry of discovering new drugs, figuring how they work, how they might interact with other drugs, and how they're handled by the body.
And also teaching, because after all, medical students learn about how to prescribe, what it does, how it works from.
Right. So from pharmacologists. I mean, I've taught the gamut of pharmacy students, medical students, nursing, physician's assistants, pretty much physical therapy students even.
Yeah.
So, yeah, we run the gamut. We step in wherever we're needed.
Well, that's great, because it's very clear that you are needed. Both of you pharmacologists are needed here today. The FDA a couple months ago strengthened its warning on NSAID medications, which are probably the most widely used pain medications and maybe the most widely used medicines of any sort in the U.S. today. A lot of people are in pain. Tell us, should we be worried about this?
Well, let's find out. What do you think, David? I mean, 30 million people swallow one of these drugs every day in the United States, so it's a huge number. And probably the absolute risk is pretty small. But what really surprised me from the FDA's warning was they said, you could have a heart attack or a stroke within a week or two of starting a medicine like ibuprofen or diclofenac. And I don't think very many health professionals or patients realize it could hit that fast.
Yeah, I think that's a real shocker. And like you say, Joe, it's an extremely small percentage. But again, when you multiply it by 30 million or so people, individuals can be damaged by these drugs. And I think, it really depends from person to person what their existing health state is, their age and so forth.
Apparently, the FDA said that people with already existing heart disease or risk factors are at higher risk. Well, that makes a lot of sense. Now, we would like to hear from you. Have you been taking prescription or over-the-counter pain relievers? And what's your experience? Have you had side effects, or have you had a really good amount of pain relief from the medication? The number to call to join our conversation is 888-472-3366. You can email us at radio@peoplespharmacy.com, or you can also send us a message by way of Twitter. We are at People's Pharmacy. Again, to join our conversation, give us a call, 888-472-3366.
And we're talking about drugs such as Advil, Aleve, house brand ibuprofen, house brand naproxen, prescription diclofenac, also known under the brand name Voltaren. We'd love to hear from you. Again, that phone number, 888-472-3366. Now, the FDA warning suggests, David, that the risk rises over time. So even though you could conceivably have a heart attack within a week or two of starting one of the NSAIDs, if you take it for 6 months, a year, 3 years, 5 years, there's an increasing risk. And the higher the dose, the greater the risk. And mostly that would be prescription, the doctor prescribed dose.
Yeah, and I think what's really happening in the body here is that any drug we throw at the body tries to adapt to it. And what probably happens over time is we get an overcompensation or an overreaction of the enzymes involved in inflammation that ibuprofen and these other NSAIDs inhibit. So it's it's a complex issue, but it's definitely something to talk with your doctor about.
Now.
And even if it's an over-the-counter drug, you really want to talk to your doctor and your pharmacist about this.
Now, people hear NSAIDs, nonsteroidal anti-inflammatory drugs, and they think, well, that's what aspirin is. Why isn't aspirin included? But we know that aspirin actually has anti-heart attack effects. So it's very confusing.
Yeah, isn't that fascinating?
Presumably the FDA warning doesn't apply to aspirin, right?
It clearly doesn't. And, it's interesting. You're correct. Aspirin is not a steroid. It's classified as an NSAID, so it would be nonsteroidal. But, it behaves very differently. It compared to these other drugs, it acts irreversibly. It's like a clamp on these enzymes, and the only way that it can be overcome by the body is for new stuff to be made. So it's a very different picture, and aspirin has this beautiful effect of working directly on platelets, which are the cells in our blood that regulate blood clotting.
So it has an effect on them. What does it do? Does it keep them from sticking together and making clots?
Keeps them from sticking together and making clots, prevents what's called platelet aggregation or bunching together.
So you might actually have a problem with bleeding too much if you were taking aspirin all the time.
Yeah, this is the blood system's incredible. It has to remain fluid all the time, but the moment we have a breach in it, the moment we have a wound, we have to mobilize this clotting action. It's an incredibly delicate balance, and aspirin, at least in some individuals, can actually prevent blood clots at a low dose, prevent blood clots over a period of time.
Let's go to the phones, Terry, 888-472-3366. We go to Nick. Where are you, Nick?
Yes. Hello, Terry and Joe.
What is this address?
Well, we're not quite sure where you are. Tell us.
It's called Cumberland, Maryland.
Okay. Thanks so much. Yeah. And your experience, please.
If you've ever traveled up the Northeast, you've probably went through this area. My experience is kind of strange. I've took Tylenol and ibuprofen most of my life. I'm a 38-year-old male, and I had recently had a injury to my knee, and my physician had prescribed me 800 milligram dosage of ibuprofen, and I didn't realize that there was even a prescription dose of ibuprofen. I thought it was just, something you got over the counter. It was a very big pill, and from the first day I started taking it, I got horrible, and I mean horrible, burning sensation in my stomach. My physician told me to start drinking a glass of milk or eating some crackers beforehand. I did that, and again would get an absolute horrible burning, and just like not like a sharp pain, but almost just like almost an indigestion. So he had sent me for a endoscopy, where they had inserted a microscope down my throat and into my stomach, and they asked me afterwards if I had had any stomach issues in the past. I told them I had not, and they asked me how long I'd been taking the prescription ibuprofen, and I told them for the past 2 weeks, and the gastro doctor that did the procedure told me he saw an area in my stomach that could be possibly, maybe producing a small ulcer.
Well,
let me
Nick,
tell you, Nick,
thank you so much for bringing this up.
Now, what Nick is telling us, Dr. David Kroll, is what most people are familiar with when it comes to NSAIDs. Stomach irritation, ulcers, in some cases bleeding ulcers, or even perforated ulcers. A lot of people complain about digestive distress when they're on such medicines.
I don't think Nick's doctor expected him to develop an ulcer so quickly, but people can. Obviously, Nick did.
And he may have had some predisposing factors, but certainly it's very common for the NSAIDs, ibuprofen, probably most problematic for naproxen. But it can also occur, with aspirin as well for a variety of reasons. But it's definitely something to be aware of. And if the discomfort grows too great, definitely see your doctor.
Well, it can be life-threatening. I think
right.
That's what people don't necessarily appreciate, is that a perforated ulcer is really an emergency situation. The other thing that was interesting about Nick's call, and that is that Nick was like, well, I just thought ibuprofen was over the counter. For years, it was only available by prescription under the brand name Motrin.
But that was a long time ago, Joe. You are showing your gray hair.
Yeah, that's certainly true. Nick, thank you so much for the call. We really appreciate it.
Thank you.
Bye-bye.
Have a wonderful day. Bye-bye.
So it's not just cardiovascular. I mean, we focused on that because that was what the FDA's new warning was about. But GI problems, that's been around for decades.
Yeah, been around for decades, and I think it's something we need to pay attention to. And as you said, even though these drugs are over the counter, they're available in 1,000 tablet bottles at your local warehouse. You just have to be careful with over-the-counter drugs as you would for a prescription drug.
We need to take a short break. When we come back, we're going to talk about non-drug approaches to treating pain and inflammation, and we'll find out why the SPRINT blood pressure study was stopped prematurely.
So we'll find out what your favorite approaches to non-drug pain relief are. Do you use herbs?
And we welcome your calls at 888-472-3366.
You're listening to The People's Pharmacy with Joe and Terry Graydon. If you're enjoying this People's Pharmacy podcast, why not head over to our website? Well, you'll find a wealth of information on medications, conditions, home remedies, and ways to keep yourself healthy. You'll find it all at peoplespharmacy.com. Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is made possible by Redix Industries, makers of utterly smooth creams and lotions that moisturize deeply to make dry skin feel soft and smooth. The number's 800-345-7339. Online at uttercream.com.
If you would like to order a CD of this show, you can call 800-732-2334. It's show number 1005. You can also find it online at peoplespharmacy.com.
Today we're talking about the health news that matters to you. We've been discussing the pros and cons of pain relievers and how to get relief without medications. That's what we're going to talk about next.
Joining us in the studio is Dr. David Kroll, pharmacologist and health journalist. You can find his writing at Forbes.com. And we invite you to join the conversation at 888-472-3366. You can also email us, radio@peoplespharmacy.com, or get in touch through Twitter. We're at People's Pharmacy. That number again is 888-472-3366. And if you have an effective way to alleviate pain and inflammation, we'd love to hear from you. Joe, it looks like we've got a caller who is offering exactly that. Dr. Charles, welcome to the People's Pharmacy.
Hi. Hello, Terry and Joe.
Hi, Dr. Charles. What's the story?
My question as a primary care general internist is why can't we look at salicylate, S-A-L-S-A-L-A-T-E, an aspirin derivative that does not affect the stomach, in fact, is approved by the VA for administration to patients who have had a GI bleed from nonsteroidals. But salicylate is a drug that is not even recognized by the CMS or Medicare as being a drug. And in a 2007 article, the American Heart Association said that salicylate should be considered first-line therapy for pain. And so we have something that's approved by the American Heart Association, not recognized by CMS, and we primary care physicians who see people with knee pain all the time cannot prescribe that on Part D plans, mostly.
Well, that's crazy. And you know what, Dr. Charles? I love it that you have mentioned salicylate because it is one of my favorite drugs. It is available only by prescription. You can't buy it over the counter. It is a sort of derivative of aspirin in some respects. It doesn't, as far as I know, have the anti-clotting effects of aspirin. So therefore, it's not going to prevent heart attacks and strokes, but it will relieve pain about as well as aspirin or other NSAIDs without as much. I'm not sure it's zero GI side effects, but way less likely to cause complications. And you know something else, Dr. Charles? There is some fabulous data out of the Diabetes Center up in Boston. Is it
Joslin Center, yeah.
That suggests that salicylate can actually either prevent diabetes or lower the risk of type 2 diabetes because it has an anti-inflammatory effect. I think it's NF-kappa B is the pathway. So, Dr. Charles, we're totally on board. Thank you for bringing to our attention salicylate, and we wish more doctors were aware of it.
And shame on CMS for not putting it on the formulary.
Yeah, they can't be shamed. I can tell you that right now.
Okay.
Dr. Charles, thank you so much. And you are, if I'm not mistaken, the physician who brought benfotiamine to our attention. Is that right?
Right, that's right.
And tell us a little bit about the latest on benfotiamine for peripheral neuropathy.
Well, I think it continues to be a very well proven remedy for patients. But I can tell you right now that any attempt that I make to convince physicians that it's good is a worthless attempt on my part. And that physicians look at it as sort of homeopathic therapy. And my advice to patients is to look at it as something they should consider themselves, even in spite of antipathy by physicians towards its use. And
benfotiamine is a vitamin, right? Basically,
well, but it's synthetic. It's not found in nature, right?
Right, and good old Whole Foods won't stock it because of that. But there's more than 60 years of experience of its use in Germany. The E Commission in Germany says that it has no side effects. So I can't say anything other than if you're against synthetic compounds, so be it. It delivers thiamine inside the cell, which is so important, and it helps to replenish intracellular thiamine in the form that goes into an enzyme that's extremely important for the vasculature, and that's probably why it acts so well and in a neurovascular pain situation such as diabetic peripheral neuropathy.
And explain what it feels like to have diabetic peripheral neuropathy. What are the symptoms?
Well, it's extreme pain, mainly at night, and it's not just numbness. Understand that it's not just numbness of the feet, and it's usually at the bottom of the feet, but it can progress upward to the lower legs and even higher. And it can wake people up. It can prevent people from sleeping. It can really lead people to take narcotics, which, of course, is not something that we want to promote. And I've seen patients over 48 hours who are formerly on narcotics for the diabetic peripheral neuropathy basically be able to get off of those narcotics because they took benfotiamine.
Dr. Charles, thank you so much for talking with us on the People's Pharmacy today.
Sure, glad to.
Bye-bye.
Thanks, Terry. Thanks.
Bye-bye.
You are listening to the People's Pharmacy with Joe and Terry Graydon. In the studios with us today, Dr. David Kroll, pharmacologist par excellence. We love the smell of pharmacology during the day, morning, noon, and night.
On the radio. And Joe, we have a message on Twitter. C says, I've always heard that aspirin is dangerous, so I never take it. What's the legitimacy there? And she is tweeting as social static. Aspirin, is it dangerous?
I mean, it's all relative. Danger is relative. Aspirin has its benefits and side effects. So does Tylenol, acetaminophen. Aspirin has problems with gastrointestinal, irritation. But it's a great pain reliever, as good as the other NSAIDs.
Yeah, we forget that. Aspirin's been around for over 100 years. It is the gold standard. There's nothing better.
In terms of pain relief.
Advil is not better than aspirin.
Yeah, people are very surprised about that, but it's very true.
And what's more, aspirin has all of these other interesting benefits, such as anti-cancer benefits.
But again, just to be very clear, aspirin, you want to talk to your doctor and pharmacist, because if you have other sort of bleeding issues, aspirin may not be for you.
Absolutely.
And aspirin and NSAIDs interact with a lot of other drugs, so this is not a do-it-yourself project.
Let's go to the phones. Karen in Ivyvale, West Virginia. Welcome to the People's Pharmacy. Your question.
Hello. My question is acetaminophen on that FDA warning list?
No, it's not actually. Acetaminophen is actually not an anti-inflammatory drug. Believe it or not, it can only lower fever and treat pain. So it doesn't have those other effects on blood clots, so it stands apart. Now, of course, we want to also be careful with acetaminophen because very high doses of it can damage the liver. And that's being pushed a lot by some of the retail pharmacies, really trying to make people aware. But in terms of this issue on blood clotting and heart attacks, acetaminophen is not a problem.
No, I think one of the big issues, and thank you for your call, Karen, with acetaminophen is that it is found in so many products. So somebody might be taking an allergy medicine. There could be acetaminophen there. They could be taking a cold pill. They could be taking something for their migraine,
And a nighttime pain reliever.
Nighttime pain reliever. Yeah. So they might be getting 3 or 4 different drugs, all containing acetaminophen, and getting way too much. So
that makes it pretty easy to exceed the recommended dose, because the top of the recommended dose is real close to where you can get into trouble.
Indeed. We go to Tidy Island, Georgia. Hi, Kathy. Welcome to the People's Pharmacy.
Hey, thank you very much for doing your show, Joe and Terry and David. Thank you for being there. My question is, I had been prescribed naproxen to deal with the pain from an ankle injury. and a surgery from the ankle injury. So I dutifully took it. The dosage that was prescribed for my body was way too much, so I ended up cutting it in half. But here's the issue that I experienced, or at least I attributed it to the naproxen, was I usually ended up taking the naproxen at night just because it would make me too drowsy during the day and I just couldn't function. So I took it at night, and during the night I would wake up and with heart palpitations. So by the time I woke up in the morning, it was as if I had been running, all night long and just didn't feel rested at all, even though the drug made me very sleepy, and it certainly reduced my pain. There was no question about that. So I'm wondering were the two connected, where it was. It seemed to me they were, but I defer to you.
Kathy, it's possible. It's possible that, especially because you found that it made you sleepy, that doesn't happen to everybody. It does happen to some people.
Well, actually, it's one of those side effects, Terry and David, that I don't think people pay much attention to because they don't think of nonsteroidal anti-inflammatory pain drugs as sedatives.
But Kathy's not the first person who has reported that side effect. And in terms of heart palpitations, I think some other people have reported that as well. So Kathy may be just a little unusual, but she's not completely off the charts.
Absolutely. Kathy, thank you very much for the call. Bye-bye.
Bye-bye.
But this, I won't call it a drowsiness so much as a kind of a brain fogginess. And we've heard this many, many times. There's one last side effect, and then we're going to move on to non-drug approaches to pain, and that is congestive heart failure. There is a linkage between nonsteroidal anti-inflammatory drugs and heart failure. And I don't think people understand what heart failure is, David. Could you give us a just quick thumbnail? Because it's very different from heart disease.
Right. I mean, heart failure is when the heart beats less efficiently and therefore pumps out less blood. People would call it this ejection fraction, that is the percentage of how much blood gets pumped out of the heart. So if it's operating less efficiently, you end up with a lot of other issues depending on which side of the heart. It can cause pulmonary issues, issues in the lungs. It can cause issues in the liver, in fact. So it really depends on the flavor of congestive heart failure, but definitely another issue to be aware of.
So let's switch to non-drug approaches. You have studied botanical medicine for many, many years, and there are, let's call it what it is, herbs that can actually have anti-inflammatory benefit.
Oh, well, before we start in on the herbs, Joe, somebody called to remind us that ice packs can help reduce inflammation from an acute injury, and that's worth remembering.
Absolutely. So what about turmeric, curcumin, as an anti-inflammatory herb? What about boswellia? There are a whole bunch of things. Do they work? Have you any scientific basis for recommending, for example, that somebody try? If they can't tolerate an NSAID, what else can they do?
Yeah, I mean, there's one other thing I want to do before we go away from the drugs, and that is if you have issues with joints, topical or ointments of prescription drugs are sometimes useful. Diclofenac, as you said, or it goes by brand name Voltaren, something I actually use for an Achilles tendon issue, because you can't, you don't want to take high doses of it orally, but you can get high concentrations locally, and that's useful for the knee, for the ankle, and so forth.
It's so interesting. When we were in Italy, you could buy Voltaren gel over the counter.
Right, and they had it in a formulation called Emul Gel, which, if you look at the Cochrane collaboration review of NSAIDs, the Emul Gel is apparently one of the more effective ways of using a topical NSAID.
I've never understood why we can't get these topicals here, because they're somewhat safer than oral drugs.
Well, your doctor can prescribe Voltaren Gel.
Right, but it's pretty expensive. But as you point out, it can be effective. Now, in the 2 minutes before the break, what about botanicals?
It's funny, Terry, that you mentioned the Cochrane collaboration, an independent objective review of clinical data. There are actually 4 herbs that are probably reasonable, either topically or in pills.
Has the Cochrane collaboration actually looked at those?
They have, specifically for low back pain. So not so much for inflammation, but there's an herb that's in the news a lot now called Devil's Claw, which has some or analgesic, I guess, activity. There are some other things like you said curcumin. It's really a compound from spices. You have to take very high doses of it. There are some new curcumin tablets that actually are a little better absorbed into the body and last longer. Arnica oil, sometimes, particularly in massage oils, very common. You can buy high-quality products in the U.S. from Germany, in fact.
And that one needs to be used topically.
Topically, I'm sorry. Yeah, it comes as an oil.
Whereas the other 2 are things that you would take orally.
Take orally, exactly.
What about fish oil? I mean, I remember interviewing a physician who was the team surgeon for the Pittsburgh Steelers, and he said, I actually use fish oil for some of my football players, and it does seem to have some anti-inflammatory effects.
Yeah, I'm not as familiar with that, but we do know that different types of fats in the body can affect inflammation, and really sort of the balance, because the fats feed into these inflammatory chemicals that are produced by our bodies. So it's this sort of weird balance.
Now, there's something called, is it, Terry, frankincense? We always hear about the 3 kings and, bringing frankincense and myrrh.
And frankincense and myrrh actually both come from the same botanical family. It's a tree. It's a family of trees. And boswellia, which is what you're thinking of, comes from the same family of trees. It's from India and Africa, and it too has some very interesting anti-inflammatory activity and can be used, I understand, for pain relief.
Well, we'd love to hear from you. Have you tried non-drug approaches for your arthritis, for your inflammation, for pain, whether it's in the knee or the shoulder or the hip? Have you had any luck with curcumin, the active ingredient in turmeric? Give us a call, 888-472-3366. If the lines are full, you can always reach us via Twitter at People's Pharmacy or by email, radio@peoplespharmacy.com. We are going to take a short break, but when we come back, we're going to talk about Sprint. It stands for Systolic Blood Pressure Intervention Trial. They asked a question: will lower blood pressure reduce the risk of heart and kidney disease, stroke, or age-related declines in memory and thinking? They stopped the study early. We'll find out why. Join the conversation, 888-472-3366.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
If you like the information you hear when you listen to The People's Pharmacy, you may also enjoy our book published by National Geographic. It's The People's Pharmacy Quick and Handy Home Remedies, available online at peoplespharmacy.com or at your favorite bookstore.
Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is brought to you in part by Red X Industries, makers of Utterly Smooth, creams and lotions helping dry, cracked skin feel utterly soft and smooth. The number's 800-345-7339, online at uttercream.com.
And if you would like to purchase a CD of this show, you could call 800-732-2334. It's show number 1005. Or you can find it online at our website, peoplespharmacy.com.
Dr. David Kroll is here in the studio with us today to help us answer your questions. He's a pharmacologist and health journalist. He writes for Forbes.com. His research focused on the discovery of anti-cancer compounds from natural sources, and he's an expert on botanical medicines.
And today we're exploring the stories behind the health headlines. We've been talking about NSAIDs and the FDA's new warning about being very cautious to make sure you don't get into trouble with your pain relievers. Now we're ready to talk about non-drug pain relief, and if you'd like to join the conversation, the number to call is 888-472-3366. You can send us an email, radio@peoplespharmacy.com, or send us a message through Twitter. We're at People's Pharmacy.
Now, David, before we take any calls or go to the emails, you were going to tell us a little bit about one of my favorite foods, because I happen to be a pepperhead. The active ingredient is?
The active ingredient is capsaicin, and this is the fourth drug that the Cochrane collaboration said is good for lower back pain. Again, it's sold as a cream. Capsaicin is interesting because it walks that fine line between an herb and a drug. In fact, so it's a naturally derived thing from hot peppers, but it works very specifically on pain pathways in the body. It's now available in a ointment, and it's the kind of thing like most herbs come in different kinds of doses. You have to be very careful with the dose of capsaicin, which is why it's sold as an over-the-counter and sometimes even prescription drug product. The Mayo Clinic has a great website that goes through the different brands of the capsaicins, but I think that's a very interesting sort of middle-of-the-road alternative to some of the nonsteroidal drugs.
Now, it's a kind of hot feeling when you put it on. It may even sting just a little bit, but it does deplete the body of something called substance P.
Substance P, which is a little protein that mediates pain impulses in the body. That's exactly right. So it's very different than how the anti-inflammatory drugs work, like ibuprofen and naproxen.
Now, we do have a couple of emails I'd like to share with you. We have an email from Susan who says, as a woman in my 70s, I've been taking glucosamine supplements for years for pain and stiffness in my knees and hips, and more recently in my neck and lower back. I used to take ibuprofen, but it raised my blood pressure, so I dropped it. Last year, I found a glucosamine product with turmeric and boswellia, and it makes an enormous difference. It reminds me how lucky I am to be almost totally pain-free day and night. I can't recommend it highly enough. She's in Lost Hollow, West Virginia.
Well, speaking of blood pressure and raising blood pressure, one of the complications of NSAIDs, there was a fascinating health report this week, David. I don't know if you saw it, but SPRINT. It stands for, and I always love these acronyms, Systolic Blood Pressure Intervention Trial. And they had 9,300 people that were randomized to either get their blood pressure below 140 or below 120. These are people over 50 years of age. And they weren't supposed to break the code until 2017. But they said, after a preliminary peek at the data, whoa, it would be unethical to wait that long.
So what did they learn?
So the data are actually very sparse compared to all the hype that we're seeing, right? So the data showed that lowering your systolic, the top number of your blood pressure, below 120 reduced cardiovascular deaths by 25%. So that sounds like a big deal. The problem right now is we don't have all the data to actually see what's going on, particularly what kind of side effects these dramatic drops in blood pressure are causing in folks, as you said, 50 and older. These are considerations that, we don't have the information on yet.
Well, I think your point is very well taken. We need to know what the absolute risk reduction is. There's this thing called relative risk versus absolute risk.
And relative risk is always more impressive, and that's what they gave us in the press release when they stopped the trial early. So they say getting blood pressure below 120, this is the systolic blood pressure again, getting it below 120 reduced things like heart attacks and strokes by about a third, which is a relative risk, and sounds real impressive, and reduced death, the risk of death, not the absolute long time, but just during the study, people were 25% less likely to die. But how many people died anyway during that study? It might have only been a few hundred.
Well, that's why we need more data. Yeah. But at the moment, I think we would all agree lower blood pressure is better than higher blood pressure.
But what we have known for a long, long time is that lower blood pressure is especially great if it happens essentially effortlessly, if you're not taking medication for it.
Whoa, just 1 minute. What do you mean by effortlessly? If you mean losing weight and exercising more, that's not effortless.
No, I was thinking of people like me who are lucky enough to have naturally low blood pressure.
Well, you're barely alive. I mean, when we take Terry's blood pressure, what is it? The last time yesterday?
95 over
50. It's like, are you serious? I mean, 95 systolic. 50 diastolic. But the point is that, if we can get blood pressure down through lifestyle, and we know there are things that you can do. You can lose weight, you can exercise, you can follow what's called the DASH diet, Terry, which stands for?
Dietary approaches to stop hypertension. And maybe that's why my blood pressure is so excellent, because I eat so many vegetables.
Yeah, and one thing I want to mention, though, about this SPRINT trial is the endpoint that they were, the thing that they were trying to do was lower blood pressure. I went back to the original study design, and it turns out that there are 15 different drugs that are used in this trial to lower blood pressure. I mean, so this is why I'm cautious and saying, there's a lot of different roads to lower blood pressure.
So it's a really kind of a complicated trial. It might be that one or another of these medicines is actually better for you than some of the others,
and safer. And just to top it off, one of my favorite journalism review websites had a title of an article. It said NIH and news media need to slow down on the SPRINT hype, and I think that's a good message for now. You'll see more information come out in the coming months.
Right. And what worries me is somebody in their 60s, 70s, or perhaps even 80s who might have a systolic blood pressure of 140 or even just 130, panicking and, trying to get their blood pressure below 120 and then developing side effects like dizziness and then getting up at night to go to the bathroom because a lot of these drugs have diuretics in them which make you pee, and then falling and breaking a hip.
Joe, you mentioned earlier that weight loss is one way to bring your blood pressure down, and we all acknowledge that it's not easy. It's not at all easy. But we have just actually had a tweet from someone named Jane who actually was interested in finding out whether carrying around too much weight is also a factor in joint pain, and I think it's pretty well established that it can be.
Absolutely. I mean, I think if you talk to the rheumatologist, they would say losing weight is one of the key elements in easing problems with joints.
So all we need now is a way for people to lose weight.
Exactly. We'd like to hear from you. Have you had problems with blood pressure medication? Have you gotten your blood pressure down without medication? Give us a call. 888-472-3366 is the number to share your blood pressure story. Again, 888-472-3366. Now, before we sign off today, I do have to do, my typical rant.
Have you got your soapbox ready?
I do, and I am interested in your perspective on this, David, and that is the high cost of medicines. There was an article by Zeke Emanuel, and Dr. Emanuel has been a guest on the People's Pharmacy. He is an oncologist. These days, he's serving as a professor at University of Pennsylvania, is it, Terry? And I think he's also a provost. Is that correct?
Yes, that is correct.
And Dr. Emanuel had an op-ed piece. Was it in the New York Times?
Yes.
Yes, it was.
Yes, sir.
And basically he was saying this is not sustainable. We cannot continue to pay $120,000 and up, because some of these drugs are now $150,000 a year. These are important new advances in the treatment of cancer. And David, this is one of your areas of expertise. You were a cancer researcher for many years. What do you think about these prices?
Yeah, I think, the prices are indeed high. And you can't really, generalize. Some prices are high for a really good reason because they give a significant advantage over old drugs. I think what comes in is when people see that a drug prolongs life by 3 months, by 5 months, and it costs $100,000 a year. Is that really a necessary price? We're paying for, though, the innovation that goes into creating these drugs, not just the way the pill looks or the IV looks. So I think that's an important consideration. And that drug prices operate in this whole healthcare system. So you also have to consider the drug's price relative to the cost of not taking the drug.
I hear that, and I understand it. But, I was around when the Orphan Drug Act was first initiated, and I remember going up to the FDA and congratulating them on this really marvelous new approach. Give tax benefits to the companies, give them incentives, because they were never going to be able to sell enough medicine to make a profit. Guess again. Cerezyme, and I don't know how you pronounce it. Is it Gaucher's disease?
Yeah, Gaucher's disease.
$300,000 a year for life. And these drugs can prolong life, so it could be many, many years. $300,000 a year. Or, and I don't know how to pronounce it, but Kalydeco for cystic fibrosis, another $300,000 a year drug. I mean, nobody can afford that unless you're a billionaire, and insurance companies can't sustain it.
Well, Joe, I think you're slightly missing the point here. These drugs that you've just mentioned are for very specific small numbers of patients. It takes almost the same amount of money to bring a drug to market to treat 3 million people as it does for 300 people.
But they got tax breaks, David.
They got tax breaks, but for example, the $310,000 drug Kalydeco for cystic fibrosis is for a very, very small percentage of all cystic fibrosis patients, which is already a small number. If we want to help people, we're going to have to pay the cost. And just people are talking about precision medicine these days. Don't forget, as medicine gets more and more precise, the patient population gets smaller and smaller.
Well, one of the things that Dr. Emanuel talks about in his article is, are we actually getting the benefit from these medications? And he points out that Sovaldi for hepatitis C, which has come in for a lot of criticism because it is very, very expensive, is actually worth the expense because it cures the disease. And whereas some of the other very expensive drugs, especially the ones for cancer, may only prolong survival for a relatively short period of time.
Well, we may not agree on this one, but that's okay. And I think that the bottom line is that ultimately we are going to have to pay a lot of money for really big advances, but will we be able to sustain, for example, an Alzheimer's drug if they charge $150,000 a year per patient for 5 million people?
Now, while we're talking about drugs that a lot of people take, let's think about some of the oral anticoagulants. We have an email from George who says, what additional benefit over aspirin is an expensive drug like Eliquis? I am on this $300 a month medication to prevent clotting if my heart gets out of rhythm. So please enlighten George and the rest of us.
I don't think I have an answer. I mean, clearly Eliquis is a powerful drug. Aspirin is an anti-clotting drug, but it probably is not as effective as Eliquis.
Yeah, and I think the issue, too, he didn't really tell us exactly his entire career. My mom has stents put into some of her vessels, and she needs to take a drug like that because those things increase the risk even greater of having clots. So it really depends on your particular situation whether it's worth the additional cost.
Let's take one last call. We go to Milwaukee, Wisconsin. Hi, David. What's this about ginger for high blood pressure?
Yes, for high blood pressure, for arthritis and pain relief. It is actually a natural ulcer protective. So while you're thinning your blood naturally, it'll improve your digestion, and it's a terrific antioxidant as well, and it's next to nothing.
And is this something that you use, David?
Yes.
Okay. Well, we have heard about ginger. Dr. David Kroll, your thoughts?
Yeah, I'm not familiar with its effect on blood pressure, but it certainly does have anti-inflammatory effects, and it's very, very well recognized to be calming to the stomach. One thing I do want to caution people with ginger and other herbs, a lot of plants have blood-thinning chemicals in them. And so, again, if you're on any of these other anti-clotting medicines, be very, very careful with your herbs. Speak to your doctor, your pharmacist. And I can't stress that enough, the blood-thinning effect of herbs, because it's a natural biological defense of plants out there in the wild.
And there could be some serious interactions.
Very serious.
Well, I think of the G's in particular. Ginger, garlic, and ginkgo all can have some anti-clotting effects.
And don't forget turmeric.
And don't forget turmeric. We've actually had a number of people who have told us they were taking a blood thinner like warfarin, for example, Coumadin, and started taking turmeric for their arthritis pain. And all of a sudden their INR values, which is a measure of, how much your blood is clotting, started to go way too high and were at risk for a hemorrhage. So, yeah, this is something that's really important. We are just about out of time. There's one last story. I haven't looked at it very carefully. David, have you looked at it? Making your bed may be hazardous to your health.
I'm so gratified that this came out in the news that because dust mites like to live in very moist areas, making your bed traps in all that heat and humidity and allows the dust mites to proliferate. Don't make your bed because the dryness and the light will kill more dust mites, creating fewer allergies. Mom, this is why I never did that.
I think kids all over the country are going to be delighted to hear they don't have to make their beds.
I don't think this one's going to fly. That's all the time we have. Thank you so much for listening to The People's Pharmacy. Thanks to Dr. David Kroll for joining us in the studio. He's a pharmacologist, a health journalist. He writes for Forbes.com. His research focused on the discovery of anti-cancer compounds from natural sources, and he's an expert on botanical medicines. He's a graduate advisor board member for the Master's Program in Science and Medical Journalism at the University of North Carolina at Chapel Hill.
Lynn Siegel produced today's show. Sophie Copeland provided technical assistance. Al Wadarski is the engineer. And Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is made possible by Redex Industries, makers of utterly smooth Extra Care 20 cream with 20% urea for extra skin protection. The number's 800-345-7339, online at uttercream.com.
And if you would like to order a copy of today's show, a CD, you can call 800-732-2334. Today's show is number 1005. That number again is 800-732-2334, or you can place the order online at peoplespharmacy.com. When you go to the site, you can tell us what you think about the show. You can also find information on prescription drugs, herbs, and home remedies.
You can also subscribe to the free podcast of our show or our free email newsletter. It's all there at peoplespharmacy.com. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you so much for listening, and please join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to The People's Pharmacy.
Here in America, work is in trouble. We've offshored our manufacturing, sent away good jobs, and lost so much ability to make things. American Giant is a company that's pushing back against this tide. They make high-quality clothing, sweatshirts, jeans, dresses, jackets, and so much more right here in the USA. Visit American-Giant.com and get 20% off your first order when you use code STAPLE20 at checkout. That's 20% off your first order at American-Giant.com, promo code STAPLE20.